Disease overview. Pediatric Crohn's disease is a rare inflammatory bowel disease characterized by severe chronic inflammation of the intestinal wall or any portion of the gastrointestinal tract. The large intestine, also known as the colon, is a long, narrow folded tube that connects the small intestine to the anus. The last segment of the large intestine that connects to the anus is called the rectum. Signs and symptoms. The signs and symptoms can vary from one person to another. Sometimes, symptoms occur with no identifiable triggering event. Common symptoms of pediatric Crohn's disease are cramping, abdominal pain and chronic episodes of watery diarrhea. Blood may at times be seen in the diarrhea. Loss of appetite may cause some children to fail to gain weight and grow as would be expected for their age and sex. Some affected children may develop bleeding within the gastrointestinal system. Anemia is associated with fatigue, pale skin color, pallor, lightheadedness and other symptoms. Causes. The exact cause of pediatric Crohn's disease is not fully understood. Most likely, pediatric Crohn's disease is a multifactorial disorder, which means that multiple factors must occur together for the disorder to develop. Affected populations. Crohn's disease is a common disorder, affecting as many as 780,000 people in the United States. The disorder is most common in individuals between 15 to 35, with approximately 25% diagnosed by age 20. Disorders with similar symptoms. Ulcerative colitis is an inflammatory bowel disease, IBD, of unknown cause. However, particularly in children, the entire large intestine can be affected. In other people, symptom onset may occur as early as the first year of life. Some children and adolescents have what doctors call indeterminate inflammatory bowel disease. These children have signs and symptoms of both Crohn's disease and ulcerative colitis, and one disorder cannot be distinguished from the other. There are numerous additional disorders and conditions that can cause signs and symptoms similar to pediatric Crohn's disease, including various gastrointestinal infections, lactose intolerance, celiac disease, peptic ulcer disease, functional diarrhea, irritable bowel syndrome, various disorders where the immune system does not function properly, immunodeficiencies, and intestinal tuberculosis. Additional disorders include Behçet syndrome, pediatric graft versus host disease, Hennig-Schönlein purpura, chronic granulomatous disease, and pediatric forms of colorectal cancer. Diagnosis. A diagnosis of pediatric Crohn's disease is based upon identification of characteristic symptoms, a detailed patient and family history, a thorough clinical evaluation, and a variety of specialized tests. Pediatric Crohn's disease may be suspected in children or adolescents with chronic abdominal pain, diarrhea, weight loss and anemia. Treatment. Psychosocial support for the entire family is essential. As well, several of the organizations listed in the resources section provide support and information on inflammatory bowel diseases like Crohn's disease. Specific therapeutic procedures and interventions may vary, depending upon numerous factors including the severity of the disease. Children will respond differently to therapy, and the best therapy for one child may not be the same for another child. The treatment options for pediatric Crohn's disease can include medications, nutritional and diet therapy, and surgery. These therapies are often used in combination, with surgery being recommended when other therapies haven't worked. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.